Hello, today is October 3rd, 2009. My name is Jason Halflin. This is my final speech project for public speaking at Kaplan University, persuasive speech of policy and my perspective on medical coverage. This country is in need of some major help. Everybody can agree on that, I think. Today there's far too many people in this so-called land of the free who are forced to live sick or injured and ultimately without medical care. They can't afford any medical care whatsoever because they don't have insurance, or else they do have insurance and the insurance doesn't cover enough, and then they end up having to sacrifice money for groceries and to feed their children and to pay for their mortgages just to pay for the necessary medical help. If this is indeed the richest nation in the world, why are over 15% of Americans without medical insurance? That's according to the National Health Review survey of 2006. For dozens of years, Republicans and Democrats have gone back and forth arguing about how to address this problem. They all want to say that there needs to be health care and there needs to be insurance and people need to afford insurance, but nobody can seem to agree on what kind of government-supported health care program is the best. All while the insured people keep going on with their lives as if nothing is happening, and the uninsured people struggle to live day to day and week to week with medical concerns that cannot be afforded. Studies also show that people who have insurance typically are healthier, and people who have no medical coverage, they also visit the emergency room twice as often as those who do have coverage. That's according to the Center of Disease Control in 2005. As many people have quite accurately pointed out before, the United States is the only industrialized nation without guaranteed universal health care. I have run into the argument many times with other people where they will tell me, well, if we have universal health care, it'll take our rights away. My question is, what rights is it going to take away? How is receiving medical care going to take anything away from anybody? Other people will tell me, well, government medical care is going to cause too many people to wait far too long, and they will die while waiting in line for the government to approve a kidney transplant or some kind of cancer therapy. Well, my answer to that right now is, as of right now, there are millions of people who have no insurance, and thus they are dying waiting for money to arrive anyway. They have no coverage for these diseases and injuries that could be covered by insurance if they could afford it. It's time to take this Obama healthcare reform seriously and put serious effort into contributing our opinions and voicing our needs. We cannot stand idly by while blowhard, restrictive conservatives try to prevent the rest of American humanity to their right of life, liberty, and the pursuit of happiness. I think we've all heard that a couple times. Life, liberty, and the pursuit of happiness. Well, doesn't the right to life also include the right to good health? Or is the life only considered to have a heartbeat just enough to pay taxes? Many conservatives are quick to denounce abortions, for example, as being anti-life. But as soon as the baby is born, they want to refuse health care to it. Conservatives seem to be the main roadblock in every walk of life. Even the word conservative means to conserve. Anti-freedom, essentially. The references to reluctance to accept change, whereas liberal means tolerant, and ultimately liberal equals liberty. It is any wonder that a frequently conservative-controlled government wants to keep the lower 98% of the population downtrodden and unhealthy. I don't think it's a big mystery there. The idea that the national health care program is going to somehow ruin our country is ludicrous. People are forced to foreclose their mortgages because of overbearing medical bills. Families are facing bankruptcy every day because they have to pay for medical bills instead of their home insurance, instead of their homes, instead of their children's needs. instead of food, and their typical debt. In 2008, half of all people asked about their own foreclosure situations had indicated that their foreclosure was caused in part by a medical problem, including illness and injuries. The fact that Americans cannot survive with the expense of the current medical system and the cost thereof, illness and medical bills caused half of over 1,458,000 personal bankruptcies in 2001, according to a study published by the Journal of Health Affairs in 2008. I had great medical coverage for a while, but the spillover of additional costs that were not covered by medical insurance, such as traveling to medical visits, food, lodging, co-pays, over-the-counter meds, and supplies, it all adds up. Plus, if you become so sick that all of a sudden you are unemployed, well, it's hard, as people like to pretend they don't understand, but when you're unemployed and you start receiving unemployment or maybe Social Security, that's only 45% of your wages. How do you cover 100% of your bills when you are only receiving 45% of your pay? Plus, you have more than just your bills. You have new medical problems to pay for. The answer is you don't cover it. People like myself all over this country and state and county run into foreclosure and bankruptcy because their insurance either gave up or didn't cover enough in the first place. At the start of my illness in 2003, we cut out all of our spending drastically. No more restaurants unless they're en route to the doctor's appointments. No more movies or DVD rentals. No more movie channels. No more cable. We cut our grocery shopping way down. No more vacations. We reduced our cell phone coverage and cut out our home phone. And there still wasn't enough money to cover anything. We were still in a hole by over $800 every month. Plus, we were driving over 150 miles to and from my doctor's appointments. Many of the victims of circumstance are not clueless fools. In 2001, 56% of those who hit bankruptcy were middle class, college-educated homeowners. Locally, about 30 miles west from my house in Clare County is one of the poorest counties in Michigan. It's according to midmichigan.org. The amount of Mid-Michigan Medical Center Clare writes off for uncollectible accounts due to the uninsured population served by that hospital is much higher than the neighboring counties throughout much of Michigan. To make things worse, Clare County is dominated by government payers, dominated by people whose only insurance is government insurance. However, that only reimburses way below the cost of actually providing the care. A good analogy would be to say, I have a broken leg, but the government can only afford to pay for a broken finger. That's what they're running into. President Obama has so far been significantly more successful in promoting a cure for this awful state of affairs that so many Americans are in. President Obama has stated in a speech, each time an uninsured American steps foot into an emergency room with no way to pay or reimburse the hospital for care, the cost is handed over to every American family as a bill of about $1,000. That is reflected in higher taxes, higher premiums, and the higher health care costs. A hidden tax which ends up cutting into everybody's budget. However, this can be eliminated by a hidden tax that will be cut, or this ends up being a hidden tax that will be cut out if we insure all Americans. More or less paraphrasing from Obama in 2009. The sign of the times is ironic that the costliest health care system in the world performs so poorly. Socialized medical coverage can work. Socialism is already at work in America. We have socialized funding for public schools, public libraries, post office, firefighters, police, military. Why is it such a long shot to imagine that publicly paid health care could help so many people avoid all these foreclosures and debt? According to this information on moneyshaw.com, 46 million Americans are uninsured. 22,000 Americans is the excess of deaths among uninsured adults. 90% of of Americans are uninsured, likely to forego medical care because they can't afford it. 62% of all bankruptcies filed in 2007 were linked to medical expenses. There are 1.5 million people in families that lose their homes to foreclosure every year due to high medical costs. This graph here from the National Health Interview Survey of 2006 also shows that almost 20% of adults and almost 10% of children are uninsured in this country. If this is the richest nation in the world, why are so many Americans without medical coverage? Can a nation truly be free when they are practically barred from good health? Thank you very much. God bless America.